Brown County is discussing its efforts to cut the number of deaths from drug overdose.
Yeah, leaders stress the crisis still persists, and they use events like Drug Takeback Day to prevent prescription drugs from actually getting into the wrong hands. Fox 11's Andrew Mertens is bringing us a closer look.
It's an issue Brown County leaders realize won't be solved overnight.
It just affects all aspects of your life: friends, relationships, employment.
Overdose deaths in Brown County have been trending in the wrong direction for several years. According to data from Brown County Health, in 2018 there were 24 total overdose deaths in the county, with 9 involving fentanyl. Fast forward to 2022, there were 62 total overdose deaths, where 50 involved fentanyl. Last year's numbers show 63 total deaths, 49 of those involving fentanyl. Fentanyl was declared a community health crisis for Brown County in 2022. Leaders are using Drug Takeback Day as part of the solution.
If we have unused medication that's left in our home, in our parents' homes, grandparents' homes, and it gets in the wrong hands, that often is a first step into opiate misuse.
Agencies like the Greenbay Police Department say working to stem substance abuse can help reduce some crimes.
By solving some of these drug problems and having some of these opioids off the street, it also solves some of the other community problems, such as the thefts and the burglaries and things like that.
There's even more being done to raise awareness to the dangers of opioids. Last year, more than 115,000 educational mailers were sent out across the county.
What we're trying to do is create that frequency, that ability for us to get as much information in multiple different ways in the hands of the residents and members of our community to have the conversation.
Now, health leaders say that they want to put more of an emphasis on mental health and coping skills.
As an effort to educate, especially youth and others, so that their first coping strategy, if they're under stress, under pressure for something, isn't to seek out a substance that could later be misused.
Leaders stress people need to understand that one pill can kill. In Green Bay, Andrew Mertens, Fox 11 News.
Well, details on tomorrow's prescription drug take-back event in Brown County can be found within Andrew's story on our website at fox11online.com. You can also find more information for sites in Northeast Wisconsin that will be open for Saturday's National Prescription Drug Take-Back Day. There are more than 135 collection sites across the state.
Welcome to our Aging Disability Resource Center, a community partner of Brown County's. Great space. We really appreciate the opportunity to highlight one of our community partners, such as the ADRC. But today we're here to talk about Drug Takeback Day and the importance for community members, households, families to really think about what's in their cabinets, and is it time for them to consider to throw out those outdated or unused medications that they received during a recovery? What we know and what we've learned over at least my time as a county executive is the drugs, the opiate epidemic that this community has faced started partly with this pill that kids were getting out of their parents' cabinets. And one way was to have parties, pill parties, and they would throw them in a bowl, and ultimately kids would take them. And the next thing you knew, kids were addicted to opiates. Now, this is just one aspect to our efforts around education. Of course, there's so many other ways that our population became addicted to opiates. Matter of fact, Brown County has received, through the lawsuits, in partnership with all the counties of the state of Wisconsin, over $10 million to date in terms of the settlements from the pharmaceutical companies. And we've used those dollars to help address long-term, as the county has identified last year, how we're going to allocate those dollars to help with law enforcement, how we're going to help with recovery, education, prevention, and it's a 10-year plan, because as we all know, these issues don't resolve themselves overnight. We have mental health issues, we have addiction issues. There's just a lot that's under this umbrella that ultimately, as a community, we really need to talk about. This is just one small piece of a major problem that sometimes finds its ways into the hands of our children. And so we want to kind of talk about the importance of Drug Takeback Day and the opportunity for the community throughout areas in Brown County where you can take these drugs and safely dispose of them. If New Water was standing here, they would talk about the importance of not having those drugs going into their waterways and impact the quality of our water. Law enforcement, healthcare providers, they would talk about the importance that those pills don't end up in the hands of little ones. And so this is really kind of an important piece, and we'll have resources for the community. And of course, if they aren't able to do it this day, there's always outlets for them to take these unused medications and dispose of them properly. As you guys all know, last year we announced that Brown County has a public health crisis with fentanyl. And what we've done this past year was partner with a number of different organizations headed by our public health department to really bring forth the dangers of the one pill can kill, the lacing of drugs that are ultimately one try and our children are dying. And this board over here kind of highlights the increase of deaths that were due to fentanyl overdoses or just overall overdoses in Brown County. And I'll talk a little bit more about that. But one of the phases that we talked about last year was, what are we going to do about education, increase awareness? How are we going to get the public to start to realize the importance of having conversations at the kitchen table to discuss the dangers around fentanyl? And so just to give you a few tidbits and some facts that where you want to highlight in terms of our effort to reach the public. First and foremost, we partnered with surrounding counties, Outagamie, Shawano, and Oconto counties, where we partnered with the Greenbay Packers and the Wisconsin Counties Association, knowing that we would have an opportunity to put out a PSA that would have a large viewership. So with that PSA, we did, over a 4-month period, we did ads during Packer games, and approximately 1.6 million homes saw those ads, along with over 4 million impressions. So for that investment that we collectively did during the Packer games, we feel like we had a pretty significant overall impact on the return on investment, but most importantly, hitting homes when a lot of people are watching. As we know, people watch Packer games. In addition to that, we mailed out to approximately 116,000 households in Brown County informational packets to basically have the kitchen table discussion to make the parents aware of potential dangers. And ultimately, as we all know, what we're trying to do is create that frequency, that ability for us to get as much information in multiple different ways in the hands of the residents and members of our community to have the conversation. So we actually heard back from a lot of people mentioning that they were very thankful that we actually mailed this out to them. We also heard that through the flyers that we gave to the school districts, they handed the information to the school or to the children to bring back to the parents. They found that to be very helpful in our efforts to get the information out. So mailed to every household. We provided children in their through the school districts information to go back to their homes. We did, of course, our billboard campaign, One Pill Can Kill, in partnership with the nonprofit Saving Others for Archie, that basically said fentanyl is the new F word over a span of 8 weeks. that had approximately 1.5 million impressions. So again, we feel like our investment in working with our partners, this was another effective way for us to campaign. Anna will talk a little bit more about this, but we did create a overdose task force comprised of law enforcement, fire and EMS workers, schools, community partners, nonprofit organizations, the medical examiner's office, and the recovery community. That task force was split into 3 groups that, that targeted prevention, response, and recovery. And then lastly, we've hosted a number of community listening sessions throughout Brown County. So whether we were in Wrightstown, Denmark, Pulaski, we essentially hosted community conversations to welcome and bring to the community these conversations. And individuals who've lived the experience stood up and talked about how devastating this was to their family and how important it is for us as a community to have this conversation. In the end, you guys, we have a long road ahead of us to really get this under control. We know as a county that you can't arrest your way out of it. We know as a county that we need to work with our mental health partners. We need to increase these spaces. We know that we need to have better conversations with our children. We know that we have to have better response systems. This is going to take time. It's going to take time for us to convince the state of Wisconsin, the federal government, to increase the funding back down to the municipalities to help address these issues. One of the ways that we can best do it is by having events like today. So we're highlighting one small piece of the puzzle, which is the Drug Takeback Day, where individuals within our community can take unused medications and drop them off and appropriately dispose of them. But we're talking about the bigger, ultimate issue of how do we address overdoses within our community. To talk more about how this truly impacts public health as an overall objective and initiative behind their department, I have Anna Nick, who is our public health officer, who's going to talk about how public health is addressing this in a number of different issues in events that are taking place. With that, Anna,
All right, thank
the
you.
floor is yours. Thank you.
I'm still gonna drink a water quick. All right, so thank you, County Executive. And thank you for being here. I always appreciate when we have media partners come because that is how we get information out to the people we serve, and you play a critical role in this. So going off of what Troy started to share, he did talk and briefly talked about our data. One of our efforts has been, as a community, pulling together with law enforcement, our healthcare systems, medical examiner's office, fire rescue, EMS, to come up with an ODMAP system. That has been an amazing show of how community can come together, county municipalities, to work towards a single goal. In March of '24, Brown County Public Health was asked to pilot, it's called WeSOAR, a Wisconsin Suspected Overdose Alert for Rapid Response. It's a state spike alert system that we will begin piloting. We also continue to work with community partners to determine how we're going to best use these data points to both prevent and respond to the opiate crisis here in Brown County. One of that could include a spike alert. We'll introduce a spike alert system to the county, so that's being reviewed. Currently, if we think about the data in the different data sets, you know, here's a picture of the overdose deaths that's available through the ME's office. And you could see the steady incline that occurred up until here, and we're kind of seeing a plateau that's occurring. And that's for the overdose deaths, and that's data available to us from the medical examiner's office. When we look at some other data points that we do have available to us, we do see a very slight decline in both ER as well as EMS suspected drug overdoses as well. Keep in mind that data is for 2023 only, so it's something we'll continue to watch. You know, for trends, you really want to see over time, but for 23, that's what we have seen. So that feels positive and cautiously optimistic at the time. As far as next steps, so we did have the task force, and as we look at closing the task force piece and moving it into a coalition, because we now have a plan. The team, the task force, the community came up with an action plan that we can now focus on, recognizing it's going to be throughout the years, as County Executive Troy Streckenbach pointed out. But we're now ready to start targeting some interventions in the community, and it's going to be all hands on deck, community partners joining in. One of the things that we recognize is how to incorporate mental health into substance abuse. So as we look forward, we are going to be more intentional about incorporating mental health, especially coping skills, as an effort to educate, especially youth and others, so that their first coping strategy, if they're under stress, under pressure for something, isn't to seek out a substance that could later be misused. So like opiate or substance abuse. We really want to look at what could those coping strategies be, so their first reach is to go to those healthier coping strategies. As part of our initiative, it is determined that we do need to do more with youth. That came out loud and clear from our listening sessions, our community partners, and one of our education strategies is to target youth more. We are currently working on developing a video with community partners, and it's going to include Packer player Kenny Clark, as well as a Bellin behavioral health specialist, which will be focused on youth. Again, looking at how can we prevent misuse of medication as well as coping skills. So we're very excited about that initiative coming up. And we also recognize that it's important to prevent access to drugs. So that's why today's event promoting drug take-back is so important. And I'll talk a little bit more about that in a moment. So drug take-back. Troy did a really good job talking about this, but it's an easy way to take immediate action when we're talking about opiate and fentanyl crisis. Because if we have unused medication that's left in our home, in our parents' homes, grandparents' homes, and it gets in the wrong hands, that often is a first step into opiate misuse. So drug take-back allows us the opportunity to remove that and create a barrier so that they can't get access in the first place. So getting rid of unused drugs is really easy. It's no questions asked. You can bring them in at either our drug take-back event tomorrow. Saturday is the National Drug Take-Back event, but even if those don't work, there are drop boxes all over Brown County that people can go and drop off their unused medications because it's such a critical step in reducing drug overuse and misuse. So at any time, you can bring in those drugs that you might have in your cabinet. If not, locking them up appropriately. I know in the past we've talked about lock boxes and locking up medications. So if they're not locked up or if they're expired, it's really important to dispose of them properly. We do invite you to join Public Health and the ADRC tomorrow. There will be a drug take-back event hosted here at the ADRC on 300 South Adams Street from 10 to 1 o'clock p.m. And again, if you can't make tomorrow's event, Saturday is the national event. You're welcome to bring them at any of the locations that are laid out in doseofreality.com. Or at any time after that. But this is the big kick and reminder that this is a great way for us, especially with trying to combat the opiate and fentanyl crisis. This is a great way to help do it in our communities. I want to point out some team members here. We have Claire Paprocki and Marissa Powell, both who have worked quite extensively on this. If there are any specific questions about the drug take-back piece, lock boxes, what can be used or taken to the event or not, they'll be happy to answer those questions.
All right. That concludes the official, as you can see, the full circle, right? If we just recently had the conversation on community's action plan around the blueprint for ending homelessness in Brown County. When you go and speak with some of the individuals who are experiencing homelessness, oftentimes it's individuals with addiction issues, or AODA, or mental health. And so there's a continuum of like care here that if we can all kind of figure out how we can appropriately fit in and address certain areas, we might be able to address some of these community problems that the community is facing right now. So, but first things first, get rid of those medications that are in your cabinets at home. So with that, we have questions. Or are you guys ready for one-on-ones? Go ahead.
Yeah, I guess one question I had, you mentioned this new pilot program that you're going to be starting up with the Spike.
Yeah.
Can you maybe explain that a little more, like maybe how this will work? Again, I know it's a pilot, so it's probably still going to be, maybe you guys are still learning too, but could you maybe give a little bit more insight into what that would do and look like when that actually is happening?
Yeah, so the pilot is definitely the key, and we are still learning. We do know, so it's a pilot through Wisconsin DHS. The what we'll do with it is that piece that we have to work out with our community members. You know, we know that there's different uses for data. So for example, some data like this doesn't work for response because it's data in the past. So I think as a community, we have to determine where do we use the different types of data we have. For spike alerts, do we turn that and do we send it out to the community to make people aware of things that are going on? If it's past data, do we look at the trends to say, hey, we need more education in this area? So I think right now with the pilot, we really are trying to be intentional with what data sources we have, when they're most appropriate to be used. That way we're using them strategically, honestly, so that we can really target interventions in the community.
So the general thought with the program was, how do you take information in real time? And because there was this threat of laced bad drugs coming in, which kids would, or someone would think that is one drug, but because it was laced, all of a sudden it's in the community and immediately we see a spike of deaths or overdoses happening in a specific area. The idea was, how do we give first responders, community partners, the ability to respond quickly to that area, through social workers, through networks, to say, hey, there's a bad supply. We need to be very judicious about how we potentially use. That's kind of what the intent behind it was. Obviously, as time has gone, there's lessons learned, and there's yet to be a determining factor as to how do we actually put this out, because what that information served before may not necessarily serve today. And you have to be careful about how you all of a sudden put out information that says, right here, right now is a problem. That may create some unintended consequences that may be detrimental to that community area. So we want to be very careful about how we roll that out. Is that fair to say?
No, that's very fair, absolutely, yep.
Obviously, you talked about maybe a little bit of a plateau we're seeing, obviously, between 2022 and 2023, overdose deaths here in the county. I guess, obviously, I'm sure there's not a whole lot of data out there for this year right now, but do you have any type of insight of, do you see this being similar or maybe a little bit of a decrease with some of these strategies that have already been in place, or?
Yeah, it's too soon to get any sort of data for 24.
It's too high, period. It's too high.
Too high?
Even if it's declining, that's a good sign, but it's still too high. We wanted 0. Now, obviously, that's a little bit more of a challenge, but ultimately, our goal is through the many different impressions, the marketing that our team is doing, those conversations that are happening, will have an impact, but it's still too high.
I think to the conversations point real quick, it's still really important that, and Troy, you said this, but that families are still having those conversations with their children, because we do see them as some of the most vulnerable for who would be up next for misuse. I mean, think about what our children, they are trying to get the best grades, they're trying to be competitive in sports, they're trying to get into college, they're, the peer pressures they may face. So helping them, recognize that, how can we help you, and what are some coping skills to help get through this so that they don't reach first for either a drug or alcohol to cope instead. So really having those conversations with your kids, with your families, with grandchildren, I think is a really good, crucial step to continue to do.
Natalie?
Yeah, I apologize for being late. I had an interview run over, but if this was addressed, feel free to tell me to go away. But I'm wondering, with the latest trends with xylazine or tranq that have afflicted areas like La Crosse and Milwaukee especially, are you seeing anything about xylazine in Brown County and how that might complicate things like reversing opioid drugs like Narcan.
Yeah.
Thank you. My brain. Thank you.
Well, I would just say that it's here, from what we've learned from our sheriff's office and the drug task force unit. Is it as prevalent as what fentanyl was? I'm not sure. We haven't gotten that report. But the reality is the individual who went from not knowing about fentanyl is now seeking the next high. Mm-hmm. And so this is, those drugs they could completely undermine all the efforts that we have in terms of trying to curb, because these drugs are even more potent, more deadly, and as you mentioned, resistant to some of the recovery systems that we're putting out there, Narcan, I forgot the name of the other one, but, and so yes, that could completely undermine it. It's real and it's coming. And so again, kitchen table conversations, eliminating those early potentials like opiates and medications out of the kitchen or out of the cabinets is one way for us to combat it and prevent it in the first place.
In terms of, like, say, expanding access to Narcan, can you maybe delve in a little more of, what you might be looking at for this year in terms of whether, I think in the packets I've mentioned something about Narcan training, but also, I think we're all looking to, expand access period to make sure it's there and use for if anyone does experience someone or witness someone experiencing an overdose.
Well, I'm going to do my best, but I might call Marissa over here. But we are part of the Narcan Direct program, which does allow us to increase that expansion, or to expand in Brown County and offer that more. I know that there's been a significant community partner that's reached out who's very interested in helping to do and provide Narcan. So I think as that develops more, we'll share that announcement. But through that Narcan Direct program, we very much are available to train others on it, to provide Narcan to those that we're doing training with. They have done it with multiple schools and other entities. And Marissa over here will probably have way more info to go into the Narcan Direct program, but to say yes, there are efforts going on to continue to expand it in Brown County. Yep.
Go ahead, Natalie.
Yeah, I just have one more question. Are there any specific programs that are going to target the United Nation, knowing that there are higher rates of opioid addiction among Indigenous peoples?
Yeah, they actually have been actively involved as part of our group, but they also have a pretty significant collaboration there as well, where they have plans and strategies that they're working on. So because we're two different entities and they have their own local health, but they have been at the table. They do have plans and strategies that they're working on. So I think they'd be probably a great connection to see what they're doing locally.
And I would just add that a lot of the efforts that we just took as Brown County in partnership with the Greenbay Packers, Wisconsin Counties Association, Shawano County, and Oconto County, the money that we spent in at least the informational aspects, the PSAs, that hits everybody that lives in, in our region. And so while we may not necessarily, because we're two separate public health operations, the tactical on a branding, marketing effort, I think we're, you know, essentially benefiting anybody and everybody that lives in our region. And so that's one thing that Brown County kind of takes pride in, is that while we may have different health departments or human services departments, we can collectively help one another. De Pere is another, they have their own health department as well, so